with any of us is that if our temperature goes high enough, it will cause us to fit. That's a perfectly normal response. The problem with some small children is that for some reason, as their temperature rises, not even that high, it causes them to fit as well. And that fitting is called a febrile convulsion, which is a fit or a seizure caused by the temperature rising. They will grow out of it. It won't cause long-term problems. It doesn't mean that they're likely to become epileptic, but it is incredibly frightening for you if you happen to be dealing with it. Yes, really frightening. The key thing is to avoid it happening in the first place. And the only way to do that is to avoid their temperature getting too high. So get yourself a decent thermometer, make sure you've used it when the child is well, and if you are taking their temperature and it is raised, then do something to bring it down. So strip them down to their pants or their nappy, a fan wafting, window open. You don't want to get them too cold, but you want to cool them down. As a mum and as a nurse, I would have a damp flannel and I would just put it over their head and under their armpits. That is no longer recommended in first aid because they say that it can cause more distress than the benefit in reducing their temperature. Personally, I think it works very well. Paediatric ibuprofen, so Nurofen, works more effectively than paediatric paracetamol, Calpol, at bringing down a temperature. If you've only got paediatric paracetamol, that's fine, it will bring down a temperature, but ibuprofen will work better, providing there is no contraindications to them having it. So you would do that, you would take steps to bring the temperature down, and hopefully they wouldn't have a fit. However, if that temperature rises, and 1 in 20 little ones will have a fit if the temperature rises, and if one of their parents had them when they were younger, that causes an even greater incidence, and if both parents, it's an even greater incidence. So there is a genetic link to it as well. And if they've had one fit before, it makes them more likely to have future fits, particularly if that first fit was under the age of 1. So with any of those, if they have a fit, the management of the fit is exactly the same, whether it's caused by epilepsy, caused by febrile convulsion, caused by a bang on the head or any other injury or assault on the brain, or anything else that can cause a fit. So the management's the same. What you want to do is to make sure that they are safe. A fit can be anything from an absent seizure, when they're just rigid and staring, or a full thrashing around, tonic-clonic type, petrifying seizure, and anywhere in between. There's hundreds and hundreds of different types of fits. So, key thing to do is make sure that they are safe, so get them to the floor. If you've got someone that you're working with, get a history, find out if they've had any form of seizures before, how much warning they've got, whether that gives you time so that you can make sure they're safe, etc., etc. So, you would make sure that they're safe, you would move things away from them, you would put something under their head, if you can, because what that will do is it will allow them to thrash around, looking for a blanket, I haven't got one, doesn't matter, that's right. So you just put something under their head, you don't want to restrain their head, so don't hold their head while they thrash around because you'll make things worse. But what you can do is roll up a blanket and just support like that loosely, providing you're not putting yourself in injury, or otherwise just put something underneath, because quite often they bang their heads like that. Thank you. Okay. Look at your watch and time the fit. The fitting should last for less than 3 minutes. And certainly if it lasts for more than 3 minutes or approaching 5 minutes, you should be getting an ambulance on the way. You're going to phone for an ambulance anyway because it's not your child and it's frightening. But the paramedics will usually fits at a slightly lower priority because they're very common and they're not usually life-threatening. So you can handle what is going on. It's not that you need their expertise coming through the door. So you'll be looking at them, they will probably be thrashing around. During the fitting period, it's possible they could go completely blue and they could stop breathing for up to a minute. They're likely to bite into their lip or tongue. Nothing you can do. Let them get on with it. They'll make horrible noises and it'll be absolutely petrifying. They're likely to be doubly incontinent as well. Not a big issue with a little child, but it would be if it was one of your guys. So care for their dignity as well. And they may well be completely aware of what is happening while they're fitting. Do not let anybody put anything in their mouth. So, the fitting, if it stops within 3 minutes, they will be unconscious but breathing. You're going to check, but they're likely to be. If they're not, you would need to do resuscitation, but they're likely to be. So what are you going to do? They're unresponsive but breathing. Recovery position. Doesn't matter how you get them there. All that nice way of supporting them. You can just lift that knee up and lob them over because they haven't got a spinal injury. Just get them into the recovery position, get them into a position where they are draining. And obviously you would normally pull them towards you. If the fitting lasts for more than 3 minutes, I would be getting an ambulance on the way. And if it's lasting for more than 5, you would certainly be phoning the paramedics back and saying, we need you. Because they will need to put rectal diazepam in or use some other drugs to stop that fitting happening. When they start to come round, they may not know you, they may be confused, they may be dazed, they may be aggressive, they won't be like they usually are. But after a short time, they'll just be incredibly sleepy. And the paramedics will admit them to hospital and they will take them in overnight and they will do all sorts of tests. And the chances are, if it's a little one that was unwell and had a raised temperature, that they will say they had a febrile convulsion. It means that if they have a raised temperature again, they are quite likely to have another fit. So what you need to do is make sure that if they are unwell, you take their temperature quickly, you cool them down, and you prevent that additional fit happening. However, if they do fit again, it's likely to follow the same pattern. So you now know what to expect, which hopefully should make it slightly less scary. It means that you'll be able to tell, so if it was your child, you'll be able to tell the nursery what to expect and how long it lasts. And if it was an adult, there's all sorts of other things you can ask. So they may well have an aura, a sensation, a sound, a smell, a taste that tells them it's coming. Find out how long that warning is. So whether it's time to make them safe. Find out how long the fit lasts, what it's like, whether they're aware, what they want you to do. Find out what they're like after. And find out all the way through to when their last one was and whether there's anything else that they should or shouldn't be doing and what they would like you to do to manage it. They may say don't call an ambulance. If you feel you want to call an ambulance, that's fine. It's their choice not to go away in the ambulance after. But I would certainly, for a duty of care, and if you're working with them, be calling an ambulance, and if they choose not to go with them, that's fine. Is that okay on that?
Scary.
Yeah, very scary. You've obviously experienced one.
Yes, I have experienced twice
Oh,
with my granddaughter.
oh, very frightening.
Yes.
Was it an absent seizure or was it a thrashing around?
Convulsions.
Convulsions.
Yes. At first that happened at night. She was 6 months and she lived with me, and this is what I can do. I now show that picture because that convulse and she wanted,
completely rigid.
Yes,
Yeah.
and
Sweating and
this is
Shaking.
yes,
Really
and
hard.
I think that she died. You know what I
Yeah.
do? I take it out and put take because I thinking about tongue. And I trying and I crying, help, help, I can't to call ambulance, nothing can't, but ambulance, my house, from the other house, stay our ambulance. And I with the child, put clothes, go into the ambulance at night. When I go in, running to the ambulance, and we came to the ambulance, she start, yes, but be very high temperature.
Very frightening.
And
So now you know what to do.
Now, but then that happens next time after 3 months. Maybe same situation, we go to the, only after second situation, we in hospital, we explain what is. Because was not, when we go to sleep, she don't have temperature. And very quick, temperature high,
they can spike temperatures very quickly. Very
and
frightening.
now, and say me, if temperature, you must wait before 38. If higher, you must do something to do that.
I would even bring it down a bit lower than that if needs be.
And now I very.
I tell you one more bit of advice: don't put them into a bath to bring their temperature down, because if they end up fitting in the bath, that's really frightening.